The first conclusion we reached was that not a single atmospheric variable or pollution was associated with all organ-specific flares. For example, fine particulate matter pollution concentration changes 10 days prior to the patient visit were directly associated with pulmonary flares and with serositis flares, meaning pericarditis or pleuritis. Temperature changes were associated with neurologic flares, with rashes, and with pulmonary flares. We found that humidity was associated with joint flares, which is something that all patients tell us at visits, but we never had data to show that that was actually correct. And there were many other associations, but importantly, no variable was associated with all flares. So we are very happy that we actually did an analysis looking at independent variables, which were the atmospheric variables in pollution, and organ-specific flares, not global disease activity, which is what previous studies looked at. I think two of the greatest impacts that this may have in the future are the possibility of predicting flares. This is the holy grail of rheumatology, and if we could create a model knowing climate factors and atmospheric factors in a certain region and how they change over time, changes in pollution and other environmental factors that may affect the disease activity, we could actually predict when certain flares would occur, and then we could prevent them. The second thing is that there has been a lot of disappointment with many medications that went through clinical trials in lupus, and one has to wonder whether these trials failed partly because these environmental factors that seem to affect the disease activity were not taken into account. These are just initial steps, and we will look at this in more detail and include more environmental factors. But I think that as a first step, this is very promising.